Hi, Danny. I'm Jenna Martinez. How are you?
Hi, nice to meet you.
Okay, so let's start off with your medical history. How old are you?
I'm 21.
Okay. And have you ever had an injury similar to this one?
No, I never had it.
Okay. Any past treatments, medication?
No.
No? Okay, what does your daily activity living consist of?
I work at a clinic and I play basketball 3 to 4 times a week.
Okay. And how did this happen, this injury? What are you coming here for?
I was playing basketball and somebody passed me the ball and I was going to go shoot the ball. Somebody stepped on my foot as I was twisting and I fell.
Okay. Did you hear anything when you fell?
And I heard a pop.
Okay. How does the pain feel right now?
Sharp.
Sharp?
Mm-hmm.
Okay. So, what makes it better and what makes it worse?
It makes it better by putting ice on it, resting it. It makes it worse putting pressure, walking on it.
Okay. And can you pinpoint to where it really hurts?
Right here.
Okay. And when did this happen?
Wednesday, June 30th.
Okay. So, okay. Pause. So right now, I see a swelling on his right knee, on the medial side of that, and I also see his leg really stiff. And when he came in the clinic, he was kind of limping. So, let's unpause. Okay, so now, I'm gonna ask you, do you have any sensation of a tingling or numbness?
No.
Okay, that's good. So, we're not gonna be able, or we don't have to do any mouth tone dermatome testing for that since you don't have any tingling sensation. So now let's start off with active range of motion. I'm gonna start off with his uninjured side, and I'm gonna start doing extension first, and then I'm gonna go with flexion. But first on the uninjured side, then I'll go the other side. So then his flexion, the fulcrum is going to be on the lateral epicondyle of the femur, and then it's right over here, and then his moving arm is going to be right over here, lateral to the midline of his femur. And then I'm going to have this one aligned with his, or the moving arm aligned with the lateral medialis in the middle of his lower leg. So now I'm going to ask him to go ahead and hyperextend. Okay. So I see that he has a normal range of hyperextension of 5 degrees. So that's pretty good. Now I'm going to ask you to go ahead and flex your knee all the way as you can. As far as you can. Yes. Okay. So, like I said earlier, for the hyperextension, start at 5 degrees, so we went all the way down to 120 degrees, which is really good. So now we're going to start on the other side, on his injured side. Go ahead and relax on. Okay, so we're going to do the same thing, and I know this is a little bit injured, but I'm going to ask you to go ahead and extend your knee, or try to straighten out your knee as much as you can. Okay?
As far as I can go.
Okay, so for this one, you don't really have any degree here. It just says 0, which is kind of odd. So I'm going to ask him to go flex your knee as far as you can until it hurts. Okay, so this way. So we start at 0, and we're going to go all the way down here. And right here, he has about 100 degrees of flexion, which is 20 degrees less than the other one. So we're not going to be able to do passive range of motion just because there's too much swelling, and I don't really want to hurt him or interfere with that section. So now we're going to move on to MMTs. So MMTs are basically range of motion, but doing this on your own without a goniometer. So I'm going to ask you to extend or straighten out your leg as much as you can on this side. Okay, great. Now go ahead and flex it. Okay, that looks really good. So I'm going to grade these as a grade 3, just because I'm not putting any resistance, but he does have a full range of motion. So I'm going to go ask him to do the other side that is injured. Okay, go ahead and extend, straighten out as much as you can. Okay, now go ahead and flex it as much as you can. Okay, so that I'm going to grade it as a grade 2, just because it doesn't have that much of a full range of motion, but it still does look really, not that bad. So now we're going to move on to special tests. And this first one is called the McMurray's test. And I'm going to start off with this side. I'm going to go ahead and flex his knee. And then I'm going to externally rotate. And this should hurt on the injured side once I do it. But First, we're going to do valgus thrust, and then I'm going to internally rotate first, and then I'm going to go outwards. Any pain there?
No pain.
Okay, so externally rotate, same thing, and then this way.
No
Good?
pain.
Okay, so now we're going to do a varus form, and then I'm going to do the same thing, internally rotate, go all the way out. Okay?
No pain.
Okay, and then this way, and then we're going to go this way. Everything good? Okay, so we're going to relax this one. And then we're going to do the injured side. You can let me know if he has any pain or not, or if he feels any popping sensation. Okay, so I'm going to do the same thing. I'm going to go slowly. Okay, so I'm going to stop right there since he has a little bit of pain. Okay, so we're going to do the valgus form first. Is it this one first? Oh, yeah. So we're going to internally rotate, and then we're going to go outwards. Do you hear pop?
A little pop.
Okay. The same thing this way. Does that hurt?
Just a little bit.
Okay, let's go a little bit slowly. Okay. So then we're going to do a varus form. Does that hurt? Or no? Okay, does it hurt? No? Okay, so internally rotate. Does that hurt?
Just a little bit.
Okay. So we're going to go outwards. Do you hear a pop?
Slight pop.
Okay. We're going to externally rotate. Do the same thing. Nothing?
No.
Okay. So you do have pain.
Something.
You do have pain. Okay, so that side was painful for him. So I'm going to have this test tested as a positive. And we don't want to be stuck with one test. We're going to keep on going, try more to rule in or out the injury. So this next one is going to be called the Stamen sign. And this is going to be testing for medial meniscus tears as well as the other one. So what I'm going to do first is I'm going to flex his leg, and I'm going to rotate his ankle outwards or his knee. You feel anything there?
No pain.
No. Okay. Okay, so I'm going to do the injured side, see if he has any pain. Any pain?
No pain.
No? Alright, so this one he did test not negative. So we're going to keep on going. Next one I want to do is the Apley's test. So I'm going to have you lie on your chest, please. So it's going to be the Apley's test, and we're going to be testing on his uninjured side first, which is this side because he flipped over. So basically I'm going to be having his knee flexed, and I'm going to be compressing this bone down to the bigger bone, or the femur and the tibia. So I'm going to rotate it outwards and inwards and compress. Do you feel any pain?
No pain.
Okay. So usually if there were to be pain, I'd be distracting it just so I could ease the pain. So let's try it on this side, and you'll let me know when it hurts. So I'm going to go ahead and flex it for you slowly, and then I'm going to compress it down and let me know when you do have pain.
I have pain. I have pain.
Right there? Okay, so I'm going to leave it right there. I'm going to distract it. Does it feel better?
A little better.
Alright, so I'm going to have this test. I'm going to say this test is positive just because he did test positive for when I was compressing. So now we're going to move on and do the... Okay, so now I'm going to have my patient stand up, and we're going to be doing the edge test. This one, he's going to basically have his feet outwards, and I'm going to have him lunge or squat down. So go ahead and scoot back a little bit. Feet outwards, shoulder width, please. Is that shoulder width? Go ahead and squat. Does that hurt?
Just a little bit.
Okay, now go ahead and put your feet inwards, just like so. Go ahead and go down as far as you can. Does that hurt?
Mm-hmm.
Alright. So now we're going to be doing the Discali's test. So this one, the edge test, is actually positive because you did have pain. So now we're going to be doing the Discali's test, and you're going to stand on your uninjured side first. So, okay. That is your uninjured side. Try to square it like that. No. Like this, look at me. Okay, now go outwards and inwards. Okay, now I'm gonna have you bend your knee. Now go in and out. Okay, no pain, right?
No pain.
Okay, now go on the other side. Go ahead and go as far as you can. That hurts. Okay, it does hurt, right?
Yeah.
Go as far. Go ahead. Okay, you don't have to do it. So does that hurt?
Yes.
Alright, so that is also a positive test. And that finishes your first special test. You did really good. Daniel, good job. So now we're going to move on to the physical performance test. Oh wait, sorry. To be doing palpations, and we're gonna start off with the tibial plateau. So I'm gonna have him So right here I can feel his epicondyles of his tibia, and right here is his tibial plateau. Okay, so then from there I want to move on and try to go superiorly from that. And these are the second palpation is going to be the medial meniscus and the lateral meniscus. So in this joint space, that's where I can feel it. Okay, so then what else? So the third one, we're going to do his infrapatellar fat pad or his joint line, and it should be right over here. Right now I can see that on the other side it looks a little bit swollen, so I'm going to go ahead and see how that feels. But right here on this side it feels pretty normal and pretty tight. So then that is my third one. My fourth one that I want to palpate is going to be the medial epicondyle of his femur, which is right over here. And then after that, my last one would be the pes anterior, which should be just lateral. Just medial right over here. But I want to ask him to flex a little bit so I can feel his semitendinosus. And then from there, I'm going to go forward. And that should be where his pes anterior is. It also connects to the sartorius, which goes down over here, but it's kind of hard to palpate it. But right over here should be where his pes anterior is. So now I'm going to go ahead and do all that on the other side as well. And we're going to start off with the tibial plateau. So I can see his epicondyle is right over here, and then his plateau should be on this right here. So just up here from that is his joint space. I'm going to ask him if his medial meniscus hurts. Does that hurt right here?
Yes.
So that's where it hurts. What about this side on your lateral?
No.
No? Okay, so that's a good sign for me for the diagnosis part. So now I want to go to the infrapatellar pad, and then I could feel it a little bit swollen here. Do you have a little bit of pain here?
Just slight pain.
Slight, okay. So now my fourth one that I want to palpate is the medial epicondyle of his femur. That shouldn't hurt that bad just because it's just superior from it, but you should have a little bit of swelling there, and I can feel it too. Yeah. So yeah, it's actually right over here. You shouldn't feel any pain at all, actually. Okay, so now last one I'm going to do is this pes anterior. I can feel a little bit of swelling right over here. So I'm not going to try to push it down so hard, but I do want him to flex a little bit for me. Go ahead. That's it. That's good. So I can feel his semitendinosus right over here, and connected to that is his pes anterior, as well as connected to his sartorius. And that is it for the palpations. So now I'm going to ask him to do a physical performance test for me, and it's sit to stand. And I'm going to ask him to do it 5 times to see how his injured side looks. Go ahead. Okay. Did it hurt?
Yeah.
Or was it kind of hard?
A little bit. I put more weight on my lips.
So my diagnosis for today is going to be an acute medial meniscus tear. But to be sure about that, I do want to get an MRI just so I could roll it in. For now, I am going to just give you some pain pills, and I'm going to ask you to not play basketball just for a few weeks. So that's it for today. Thank you for coming in, Daniel.
Thank you for having me.